A lot of young guys are coming to us with problems of testes pain between 15 to 35 years of age. One of the most commonest problem which is causing this persistent dragging pain and heaviness, also they get a sensation of bag of worms, which I will explain, is varicocele. Today I'm going to break down this most common condition which is affecting young male, causing pain and infertility, and what is this condition, how can it be diagnosed, and how can it be treated. Let's break it up. I am Dr. Gaurav Gangwani, a board certified equivalent interventional radiologist, and varicocele embolization is one of the highest volume work that I do, and probably I am one of the highest global centers doing it. Let us go into details about this because I know a lot of young males are super anxious because of this and not finding a solution and apprehensive about the solutions they do find. Let's go ahead. The testes get the pure blood from the heart through vessels, blood vessels known as arteries, testicular arteries or spermatic arteries. Once these blood vessels reach the testes via capillary network, give all oxygen, nutrients to the testes, the impure blood that remains, which also collects all the free radicals, the waste products, goes back to the heart through blood vessels or channels known as veins, the testicular veins or internal spermatic veins. It starts with a plexus of veins, tiny ones known as pampiniform plexus. At the inguinal level, it converts into larger veins, the internal spermatic veins, which on the left side eventually drains into the kidney vein and then finally to the heart. On the right side, it directly drains into a large common vein known as inferior vena cava, and all this blood is taken to the heart, eventually pumped to the lungs for purification and comes back through arteries. So while this circulation, the veins are not as efficient as the arteries. They have to take blood against gravity most of the times. There's no pump helping them. And for this reason, they have valves or one-way doors which allows the blood to travel up, but if the blood starts stagnating down, they close, shut down so that the blood does not stagnate down. Occasionally, due to various theories and hypotheses, right from prolonged sitting, excessive weightlifting without adequate core and pelvic strength, inflammation in the body, the natural anatomical challenges, especially on the left side, nutcracker syndrome, meaning the kidney vein getting compressed, raising the pressure there. These testicular vein valves get damaged, because of which the blood starts collecting downwards and starts harming the testes. Now, why does this blood harm the testes? One, because it starts stretching the veins, which leads to pain signals. You always start feeling heaviness and pain and discomfort there. But the stagnation also causes raised temperature, which is not good for testicular functions, both sperm and testosterone production, and the free radicals also damage the testes, reactive oxidation species, which is again more of hypothesis. It's more complex than that, but this is what we know today. Because of these, what are the problems that these patients face? They come with complaints of testicular pain or orchialgia, heaviness and discomfort, sometimes laxity or excessive hanging because the testes want to look for cold temperatures which they are meant to have, so the latatos muscle relaxes and makes them hang. Very often these patients complain of a bag of worms kind of feeling because they can sense the large veins under the skin. They feel it's a bag of worms crawling under the skin. When it starts affecting the testosterone production, low libido, sex drive, erection issues, and when it starts affecting the sperm production, it can lead to infertility. Even in normal population, young guys 15 to 35, 20% of them are known to now have varicocele, which is a huge demographic data. So we can't ignore this disease. If you are a young male or if you know any young male in your family or friend circle, this video might be very useful to them. Do share it because I don't think you will find a more complete video on this topic. Not boasting about it, but there is an attempt being made after treating lakhs of patients and having a Hindi channel for my Indian audience with 7 lakh subscribers, and varicocele being one of the hottest and most explained topic there. So okay, you have these symptoms, you want to confirm whether it's varicocele and what is the grade of it. You go to a urologist or an interventional radiologist. I'll soon explain why do you choose the second specialist. They examine you physically. They get your scrotal Doppler done, which is the first screening test that should be done, which is also nearly the gold standard, which can tell you whether you have varicocele, which side you have it on, what is the grade of the varicocele according to a sonographic Serteschi classification. It is just a color sonography test, nothing major, and it also tells you whether there is any testicular shrinkage or any other pathology that we are missing, a hydrocele, a hernia or anything else, sometimes any secondary cause causing the varicocele. Once everything is confirmed on a Doppler, we also get a semen analysis, usually after 3 to 5 days of abstinence, and testosterone levels, both free and total testosterone, to see if any of these functions are affected. All the testing is done. We have a report in front of us. We know what's going wrong. Does every patient need treatment? Well, yes, but every patient may not need a surgery. If it is low-grade varicocele, and if there is no red flag, which I will soon explain, then you can follow simple lifestyle changes. But if there is high-grade varicocele, grade 4 or 5, and if there is any of the one or more of the red flags like shrunken testes, low sperm counts or motility or morphology or DNA fragmentation index altered, low testosterone levels, or there is refractory pain for months despite lifestyle changes, then high chances you would be needing some or the other invasive intervention, and lifestyle changes may or may not be enough. What are the lifestyle changes for a young early varicocele which has not yet caused any sequelae and the pain is also more or less controlled? Well, we first ask them to go for better undergarments, preferably briefs with breathable fabric. We tell them to do an ice massage at least twice a day. Overall, keep the testicular environment cool with briefs, with the overall air conditioned environment and so on. We give them a few pelvic floor yogic exercises. We give them a proper anti-inflammatory diet. And finally, we tell them to avoid alcohol smoking altogether and reduce caffeine intake also. Some more discussion and tips on the posture, ergonomics, lifestyle, more dietary habits is done. We try to urge them to regulate their sleep and stress levels, and that's it. We follow them up. We tell them not to forget about the varicocele. Be on surveillance every 6 months to an year and keep a watch on it to just see if everything is fine. Can the lifestyle changes reverse varicocele? Well, potentially yes as well as no. Meaning the mechanical damage most of the times does not reverse. But many times we see that the patients are much more comfortable, semen and testosterone levels are perfectly normal, and occasionally we have seen reduction in the grades also. So anecdotal experience, yes, I don't think there's much literature validating this, but I have myself seen at least a handful of patients, if not more, potentially reversing it to some extent, if not fully. Now coming to the high-grade varicocele, or that varicocele which has already caused bad effects, the traditional treatment for them was surgery. You can't correct the mechanical valves, but let's destroy the vein altogether. Let's either tie it or remove it, a procedure known as varicocele ligation or varicocelectomy respectively. It can be done through laparoscopy or an open surgical approach, but the gold standard today is microsurgical ligation. This is the place where, as an interventional radiologist, we step in and we do a technique known as varicocele embolization, where through the patient's groin or the neck, we take a tiny catheter and wire into the blood vessel supplying the testes, actually the veins that are taking the impure blood away from the testes. We identify that the valves are damaged, and rather than tying them or cutting them from above, from outside surgically, we internally inject embolic agents like coils or sclerosants or glue and knock off the entire blood supply. Now, one of the common questions most people ask us is, if a surgeon or yourself is completely tying or cutting a vein, how would the testes blood return back to the heart? You cannot cut off the circulation which is returning. Luckily, the testes has such a florid circulation and so many collateral channels pre-existing that they take over, including the external spermatic, the gubernacular, the deferential veins and so on. And the circulation is never hampered. This process takes a few weeks for it to mature, but it always takes over, which nearly I have seen my cure rates to be 99% plus, challenging those rates of microsurgical ligation with zero complication rate till date and a very decent patient experience, both in terms of pain as well as semen betterment. So this is, of course, after doing maybe more than 500 to 1,000 cases. I have even lost count after treating hundreds and thousands of patients, traveling all across the country as well as the globe, seeing our Hindi channel. And that is where I was motivated, let me create some awareness in a English language so that much other parts of the world can get benefited from this and also meet an interventional radiologist. Now, mind you, not every interventional radiologist can give the same result. I'm not saying I'm the best in the world. All I'm saying is the technique, the embolic agents, the process, the follow-up has to be standardized. There has to be a high volume experience and a decent follow-up. So I hope all this helps you really go dig deep into varicocele, how it occurs, how it presents, how can you diagnose it, and finally how you treat it, including the minimally invasive embolization option without any blades, stitches or scars, and how a good quality high volume operator interventional radiologist can really help you. We are going to talk much more about this. Our Hindi channel maybe has 80 videos about varicocele. This is the first one here. So stay tuned, subscribe, and don't forget the bell icon so that you don't miss any of them. Stay safe, stay empowered.